Okay, so my name is Bill Clemens. I'm giving this Stop the Bleed class. This is not a specific class that I'm giving that's Stop the Bleed from something that's printed out or anything. It's some stuff that I put together that I'm going to cover that I think is important. And it kind of whittles things down to just the basics. I'm kind of a visual person and I'm a simple person, and I think we need to stick to the simple so we can remember how to do things. So just kind of an interesting thing to start out. Who has a heart? Everybody has a heart, right? Okay, heart is an amazing machine. So if you have any doubt whatsoever that God doesn't exist, okay, and if you're a math person, just think about this. The average person's heart beats about 70 beats per minute. Okay, got some nurses and stuff in here, they can attest to that. Okay, about 2.5 ounces of blood per beat when that heart beats. So if you do the math on that, that's about 175 ounces per minute. 10,500 ounces per hour. 252,000 ounces per day. Okay, see how this math is adding up? 1,969 gallons per day. Okay, if I live to be 80 years and my heart's doing that, my heart's going to pump 57,494,800 gallons of blood. From that machine that never needs any work, hopefully until the day I die, right?
Yeah.
Who could do that? Who could do that? There is nobody that could create something like that. That's the human heart, and you guys all have that. So that's interesting. That's what the heart does. So just some interesting trivia things there. So people are different. Men and women are different. And it's important to understand that when it comes to treatment and trauma and how things take place and how people are going to react to stuff, right? So ladies, the big question is, how come men like football so much, right? How come you guys always like to watch football? Okay? So anybody know the answer to that? Somebody might get hurt, right? Somebody might lose a limb. How awesome would that be, right? I guess guys want to see that. That's what's car races and hockey and stuff like that. We want to see the violent stuff out there, right?
Yes.
Ladies, they don't care to kind of see that kind of stuff, okay? And guys, we want to see the rough and rugged stuff. That's kind of how we think. What's that? Except for John. Yeah. We got some lady football fans here that want to see that, okay? So when it comes to dealing with trauma, it's good to understand how people see things. So ladies, how many ladies here really like a good scar, right? No hands are going up, right? But us guys, right? This is your time to shine. Who likes a great scar, right? A really good one, right? We love that. We get together, we talk about scars, right? We brag about scars. Look at this one. I got this one at the barbecue last year, right? We do that. We really do that. And then somebody will say, I got a plate in my head. You know, they'll knock on it, you know. Somebody else will say, I got one on this side. And somebody will say, titanium's the way to go. I got one right here, right? And we brag about that kind of stuff. When we get injured, it's an awesome thing, right? So that's kind of funny, but guys do that. I'm sorry, but we just do that. Okay? So my background in teaching, I want to cover that just a little bit, okay? Years and years and years ago, I was a certified EMT, a long time ago. I'm not certified anymore, I just used to do that. So I remember a lot of that stuff, and it came in handy over the years. I'm a combat veteran, and before I went over to Iraq, I did the courses for combat life-saving courses and stuff. That was really good stuff. I really liked that and learned some good stuff about that. The next thing that I feel kind of qualifies me to do that, I get hurt a lot, right? Right? We take a lot of trips to the ER. I've had so many stitches, I don't even know how to count those stitches. And the coolest thing is those little tools that they sew you up with and the little tweezers and the pliers, they give those to you most of the time because they don't like to be sterilized. So I reload ammunition and I do things like that. So I have a huge collection though, so it's really awesome. So every time I go to the ER, it's like Christmas. I get new tools and everything. And Joan just shakes her head like, oh, he's not going to ask again. I know he's not going to ask, and I ask every time, and I get them. So that's really good thing. So I appreciate that. Okay, so with that being said, we'll talk about stop the bleeding a little bit. Bleeding is called hemostasis. Okay, when your blood is leaving your body, it's supposed to circulate on the inside, not the outside. Okay, when it's on the outside, that's a problem. We need three primary things to sustain life. Okay, we need blood. Let's start with air, ABCs. Anybody heard about the ABCs? Okay, we need air. Air is important. We have to have air. The next thing we need is blood. All of our organs need blood. Our brain needs blood. Our heart needs blood. All of our bodily organs need blood to function like they're supposed to. So that's really important. And then circulation. Has to circulate. It has to go where it needs to go. If we don't have those three things, we're not going to function really well. Okay, so some of the things that I'm going to cover here, that I'm going to tell you, you won't do those unless it's an absolute emergency. but there's a lot of things that we can do and should do, and it's just first aid stuff before we go to the hospital or the clinic. So kind of a story, when I grew up, my mom always had sheep all the time. So one year when her sheep were in the lambing process, one of her sheep was having problems lambing. She's in pain and struggling and couldn't produce these lambs. So my dad was gone, so she goes to the neighboring rancher, and he comes down and he helps his sheep have these lambs. And 2 of them are alive and 1 of them's not. And I'm just a kid, I'm like, God, I don't know what's going on. So what this rancher actually does, he picks this dead lamb up off the ground and he drops it like 3 times. And I'm looking at that like, wow. And that lamb coughs, spits up, and that thing came to life, right? I wouldn't say throw somebody on the ground if they're not breathing or anything, but that was interesting that he did that. And he said, in times like that, that lamb was dead. Kill or cure, do something. Do something. If it don't work, well, the lamb was dead anyway. If it works, well, you got a live lamb. And my dad kind of lived by that philosophy too, a rancher and everything. Sometimes we wouldn't know the dose to give animals for antibiotics or some kind of treatment. And when it was really serious and we couldn't get to a veterinarian or anything like that, his philosophy was kill or cure. I'm going to try something. It's going to die anyway, so either I'm going to kill it or it's going to survive. And most of the time, they survived. We sewed up many animals with dental floss and a needle. They'd get torn on a barbed wire fence, or something would happen. They'd have a rip or tear in their skin. We would sew them up, and we would use dental floss and a needle. That's all we used, and they survived just fine. We had a calf run under their fence once, and it cut it from between its ears all the way to its tail. Just kind of cut it open. So we sewed that calf up, and when that thing grew up into a full-size cow, it was amazing because it looked like it had a big zipper in its back. Everybody seen that cow, was like, wow, what happened to that cow? That's really weird. That's what it looked like. But we did that. Dental floss, kill or cure, and it actually worked. So there's some things you can do that way. So ABCs. So the first thing, oxygen. Our environment consists of about 78.1% nitrogen and about 20.9% oxygen. So it's not all oxygen. We have a combination of stuff out there, and we breathe that. We need about 19.5% oxygen to survive. And what I mean by that is if you go in a confined space, and even know what confined space is, okay, it's some place that you shouldn't go into unless you have somebody with you and you think about that and plan that, because it's got one way in, it's got limited air, it's not designed for humans to inhabit, things like that. And even something setting out in like an open field, like a big tank or something like that, the oxygen concentration in there might not be what it's supposed to be. And you could just go in there and you can go in there and die. It happens to kids. Kids like to climb in everything. They climb in holes, they climb in tanks, they climb in boxes, they do all kinds of stuff. And that's a very dangerous thing to do, because we need that at least 19.5% oxygen to survive. It starts getting lower than that, we have some real problems. You get down to 6% oxygen concentration, you're going to die. You're going to die pretty quick. So you need that oxygen. So confined spaces are bad. Don't do that. My neighbor one day, I'm looking over, and his wife is standing outside of a septic tank. She's got a rope around her waist. Oops. She's got a rope around her waist. And she's holding on to that rope. She's just standing there holding onto her rope. That doesn't quite look right. There's something wrong there. So I walk over there. Her husband is down inside of a septic tank. Drained it all out. He had to clean some kind of baffle in there. He had to fix it because it needed to be repaired. But he's inside that septic tank. He's got a rope around his waist. She's got a rope on her waist. And if for some reason he loses consciousness, she's going to pull him out of that tank. Okay? That's not going to happen. 3 guys can't pull a limp body out of a tank like that. So, you know, I try to mind my own business, but I couldn't stand back. I said, you got to come out of there. And we talked about it. So he did it differently. But people do that, and people die getting in confined spaces. So we need that oxygen. It's important. Blood. The human body has about 5 liters of blood in it. So this is not blood, this is juice. Just, thought about bringing blood, but yeah, that's kind of, you know, it's the church now. So that's about 5 liters right there. That's 2-liter bottles and one about half full. So we can survive on 3, but we're not going to survive long, and it's not going to be a good thing until they can get some more blood into us. So that's kind of how much blood we have in our body. And again, our heart is just an amazing machine to circulate that blood, so that's really important. We want to keep it inside. We want to keep all of it inside. Circulation, our circulatory system, we have vessels and veins and arteries and capillaries and things that handle that blood. This thing's driving me nuts.
put it under the side of your glasses, it might hold it there, though.
Wow, this thing is for professionals.
Now you gotta say.
Okay. Okay, now we'll try that. Okay. Okay, we'll try that. Everybody here okay?
Yeah, that's good.
Okay, so your circulatory system has all these things, and I'm not going to go into the details of what they do, but it's like your plumbing. It's your plumbing in your body, and it has to work, and all that blood needs to flow throughout your body. You know, sometimes you'll be in some kind of awkward position, and your arm or your leg or something will just be numb. You know, it didn't get enough circulation of blood. It needs that. Okay, that causes damage. So that stuff needs to circulate all throughout our body. So given all those things, it's pretty easy to understand why first aid is important to stop the bleeding. It's really important. We don't want to lose blood if we don't have to. Okay, so we need to know how to treat all that kind of stuff. Primary tools that you have for treating wounds and stopping the bleeding that I have here, we're going to talk about bandages, clotting agents like quick clot, medical glue, Dermabond. I don't know if people heard about sealing up wounds with super glue, kind of the same thing. Stitches and tourniquets, we'll talk about each one of those. First of all, bandages. Bandages come in all different sizes and shapes. When you think of bandages, most people think like just a Band-Aid. You take a Band-Aid and open it up and peel it off and stick it on your skin. Well, that's fine. That stops very minor bleeding on very minor wounds. Just does hold direct pressure on there, and it protects the wound. Simple Band-Aids. And then you have bandages that have thicker wadding on there and gauze padding, and you can wrap them up and treat much more severe injuries. Our circulatory system has a certain amount of pressure in it. That's like where your blood pressure comes from. So when you do have a puncture in that, that's why you bleed, and that's where it comes from. So that's what your bandages are going to do. And you always want to apply direct pressure. Never take a bandage off. Always keep adding. Just keep adding until you can stop that bleeding. The next thing is clotting agents. Clotting agents, they have chemicals in there that mostly dehydrate your blood. They pull the water out of it. And what that does, that actually helps your body's natural clotting mechanism work much faster. So like quick clot and some of these other clotting agents, they come either in a powder or already impregnated into a bandage that you just put on there. And it works pretty fast. I'm talking 30 seconds to a minute. You can stop some pretty severe bleeding with quick clot. Okay? And you don't have to, make the wound bigger with the screwdriver and pour it in, right? Don't do that. Okay? You apply it to the surface of that and it'll work. It'll stop that. It does really, really well. And I got some different examples of that I'll pull out here. Might as well do it right now. You'll find quick clot if you buy it. It's very, very expensive. Okay, this is a 2-foot piece of gauze, okay, 3 inches wide by 2 feet long, about $25. So it's pretty expensive, but if it's going to save your life, what is it really worth? But it depends on where you buy it and how much you buy. You can get it cheaper than that. But this is quick clot. There's some other brand names out there of clotting agents, but they are really important and they will help you. Yes, sir.
So is there a lifespan on those?
On these, I do not know. I don't see an expiration date specifically on there, but I think they last a long time.
I think I can get stuff wholesale.
Wholesale? Yeah, if you can get it wholesale, that's the way to go. It'd be nice for every first aid kit to have some of this in there, either in the powdered form or this is a bandage form, but have it in there because quick clot really, really works. When I was talking about bandages, you can get bandages pretty inexpensive. This right here is an Israeli dressing bandage, and what I'll do, if I can get this open, I don't know where the tear part of this is. I can pass this around, and we can actually try doing some bandaging if you're interested in that. What you do, you open this thing up, and it already has a pad, and it's sterile.
It was.
It was. Once you get all the packaging off of this, okay. Paper on top of paper.
Hurry up.
I'm trying to hurry. I'm not going to make it. I'm down to 3 liters.
Yeah.
It's called an Israeli what now?
It's called an Israeli bandage.
Okay.
So you open that up, and now I'm not touching the inside portion of that yet. So when you open that up, you can put that portion on top of the wound and just wrap and wrap and wrap. And put direct pressure on there, and that's a really thick gauze pad right there. So there's a lot of room for this to really wrap around and secure it really good. And you can get these things pretty cheap. You can get packs of 24 of these things for $15 or something like that. They're really cheap. Just look on Amazon. But that's an Israeli bandage, or Israeli dressing. So that's some things you can use. Medical glue. Now, that's not really the term for it. There's different names out there. There's some stuff called Dermabond. It comes in a tin, and it's just like super glue. And it really is chemicals like super glue, but the medical type is just a little different formulation. It's better for you. Super glue will work, and if that's all you got, you can use it, but I recommend using that other stuff. The other stuff is actually more flexible, and it's better in the long run to use for wounds and stuff like that. Super glue gets pretty hard, but it will work. The important thing to remember about super glue, when you use it for a wound, you want to try to stop the bleeding first if you can, the best you can. Make sure it's clean, and then hold the wound area together and apply glue to the outside. You can open it up and move it a little bit, and it'll glue shut. Okay, don't ever put super glue inside a wound. Don't squirt it in there. That's a bad thing. Don't do that. It's external. That's what it's for. It's for sealing up that crack or that cut. And this printout here has got more information than what I'm telling you. But it'll tell you when to use it, when not to use it, what kinds of things to use it on. You don't want to use it on animal bites, puncture wounds. There's certain places on your body you don't want to use super glue. I mean, if you got a cut on top of your eyelid, you're not going to want to glue your eyes shut. Okay, don't do that. And it's going to tell you, it's going to cover that in here. Okay, so that's the medical glue stuff. Okay, then we get over to stitches. Stitches, medical people do stitches. Yes,
Steri strips?
I'm sorry?
Steri strips?
Yep, steri strips. So medical personnel, trained medical personnel usually stitch other people up, okay? But there are times, like you were saying, and there may be times in the future where we might not have those medical facilities. We're gonna have to do things ourselves. Now, I talked earlier about sewing animals up with dental floss, okay? If I'm bleeding out, go ahead and sew me up with dental floss. I don't care what it is, okay? But that's I'm saying that. You may not want that, okay? But if my life is if that's the only thing you can do, that's what you can do. But stitching is not a bad thing. If you learn how to do it, know how to do it, you can buy stitch kits. Anybody can buy. You don't have to be a doctor. Put those in your first aid kit. If you need to use it, you can use it, okay?
I can
And he'll
do
tell you how.
I can do a class, and I've offered already to do a class on stitching.
Okay,
And we would just use a
Chicken breast.
okay.
and learn some of the basic knots and basic how to get deeper things together and how to do stuff on top and just kind
Okay.
of get some basic practice.
Yeah, that's kind of important to do. I mean, you don't want to just grab and sew somebody up and they got this huge, ugly scar in the end. There's ways to do it and stop the bleeding.
It's okay for men, right?
Yeah. However you want to do it.
Obviously, you're gonna have to do what you can do, but are there any over-the-counter things for like localized numbing?
That I don't know. I'm not exactly sure.
Just ice?
Yeah, ice or something like that. Or pull the cork out of the bottle. That's in the Western movies. I don't know if that would work or not, but I would recommend it. Yes, ma'am.
Does it matter if you use wax dental floss or plain, whatever you've got?
I would say wax is probably better. I mean, it's got to slide through your skin and cause less pain and stuff as possible. And it's just wax. It's not really going to harm you or anything like that. And a suture kit is going to come with little curved needles. It's kind of hard to sew anything up skin-wise with a straight needle. You need a little bit of a curved needle to make that work. So because we had all kinds of animals, we always had that kind of stuff. And we always used dental floss. We didn't care to buy anything else for animals because it always worked fine and they healed up good. We never lost anything that way. But that's stitches. Okay, so more to learn on that. Tourniquets. Tourniquets, remember a tourniquet is kind of the last resort for bleeding injuries. If you can't, none of these other methods work, you may have to use a tourniquet. A tourniquet is not a bad thing because it stops the bleeding right now. It's going to shut it off. Okay, it's going to hurt. Okay, but you're already hurt. Okay, one of the reasons that people are hesitant to help other people with injuries and stuff like that, they have this feeling that I'm going to hurt them more, or that's really going to hurt. So I don't want to put too much pressure on that. Okay, it already hurts. Just do it. Okay, just do it. There seems to be kind of a pain threshold. I know some things hurt more than other things. But there's a point it hurts anyway, so just do it. Anytime you put a tourniquet on, if nothing else works, you can't stop that bleeding. Put it above the injury. Tourniquets are for limbs only, including fingers and toes. Okay, if somebody has an injury on their head, they'll do that. But you don't like them? Okay, it's for limbs. That's what it's for. most of these tourniquets you can get now, they are really super easy to apply. And I'll actually demonstrate some of these in a little bit, and then you can even try it. This one has a little place that holds this twist device for this tourniquet, and it's all Velcro, so you can pull it, you can quickly put it on an arm or a leg or anything like that. You can put it on yourself if you want to, and twist it. See, that hurts, right? It hurts even more. But then you lock it off, and then there's no blood flow. So that's how these tourniquets work. You can do it yourself, and they're just simple to use on your arm or leg or something like that. If you haven't,
Is there a name for that kind?
this one right here, I don't know. I'll give you these.
Isn't that called a cat?
This, what's that?
Isn't that called a cat?
I'm not sure what that brand is.
Okay.
There's all kinds of brands out there. These, same thing, you can get these things on Amazon. You can get 10 packs or 12 packs pretty cheap. Okay, if you're expecting some mass trauma, these things are pretty good. Anytime you put a tourniquet on there, you want to put it above the injury, you want to put it as close to the injury as possible, because chances are, when they take care of that injury, they're going to lose everything from that tourniquet down. They might not, but chances are they will if there's any length of time before you get somebody to a hospital. And speaking of time, on this tourniquet right here, it has a place to write the time you put that tourniquet on there. Put the date, put the time. The doctor wants to know how long it's been on there. He's going to determine what he can save and what he can't save. So he wants to know that, so that's important. Put the date and time on there. If you're in a mass casualty incident and there's all kinds of craziness going on, another thing you should do when you put a tourniquet on somebody, put a T on their forehead. You can use a pen, a marker, you can use their own blood, so put a T there. Medical people know what that means. In the chaos of covering up people and putting them on stretchers and hauling them places, when that casualty comes into the ER or something like that, it's important that they know that person has a tourniquet under this blanket that you're covered with or something, so they can address that issue right away. They know to do that. So it's important to put the time on there and mark that person somehow so that going in, the doctors know, hey, this person has a tourniquet. That's really important. So that's.
They may not be conscious to be able to say it.
Yeah, they may not be conscious for that. Severe amputations and things like that, there's no sense in trying other things. If it's a severe thing, you're just going to have to put a tourniquet on it. An interesting thing, your vessels tend to constrict by themselves with some serious injuries. So you could have some serious injuries that do not bleed at all, and you're wondering, gosh, why is that not bleeding? Are they empty? Okay, but they're not bleeding at all. It doesn't mean they might start bleeding more later on, but sometimes it doesn't bleed like you think it should. So be cautious of that and be prepared to take care of that. And if there's an amputation, you don't have to use a tourniquet. Okay, some other methods may work, but you have to monitor that and pay attention to that. But I have several bandages and I have several tourniquets up here. If you guys want to check these out, pass them around and see how they work, you're welcome to do that. Also, you mentioned the butterfly sutures, stereo strips. Okay, some first aid kits come with these butterfly closures. Okay, it's almost like stitches, but it's just a bandage. It's got some pretty strong adhesive on both sides of it. And once you get that bleeding stopped and pull that together, stitch it with that. And just leave them on there. Leave them on there until they fall off. And it does a pretty good job. And so these are good to have in any first aid kit. There's 12 of these, so that can do a pretty good size injury if you need to use that. Just a little simple box. But most first aid kits come with that. This simple first aid kit right here, I don't even know where we got it. It stays downstairs in our EOW room. But it's got adhesive bandages, butterfly closures already in this pack right here. Cotton applicators, it has alcohol pads, rubber gloves, aspirin tablets. There's just a whole list of stuff in this pack right here. And you don't have to have a big monstrous first aid kit to take care of your family. Most of those big huge kits are for places like a church or a school or something like that that has 600 Band-Aids in there. You don't need that. You don't need to buy all that. You can buy some reasonable stuff for your house. If you're expecting mass casualty stuff or something like that, get a bigger kit. Carry that with you. Carry something in your car. You may come upon a traffic accident and you're the only one there to help, and you may need to do that. We carry tourniquets and Israeli bandages and stuff like that in our cars just in case we come across something like that. So there's several items that you can use to do that. So tourniquets are pretty important for that reason. Remember that super glue is external only. Another thing that I'm going to cover kind of briefly here, even though this is stop the bleed, is shock. Okay, shock. People die from shock. There was one of the things I learned as an EMT. There were instances where people would come upon a traffic accident, and they weren't involved in the accident, but it was a horrific accident. And the people that came upon this accident, somebody may faint or something like that because they go into a state of shock. If they're not properly treated, they can die. And there have been cases where people have died showing up to automobile accidents because of what they see, and they went into shock, they weren't properly treated, and they died, and they weren't part of that accident. So you need to know what shock is, you need to know how to treat shock. There's basically 4 different types of shock. You got cardiogenic shock. What that means is that shock that deals with your heart. Things that make your heart not function right. It can be heart disease. It can be cardiogenic shock. It can be some kind of contamination, something that just makes your heart not function like it's supposed to be, and they will call that cardiogenic shock. Blood loss can fall in that category, even though there's a specific one for that, and that's the next one, hypovolemic shock. Think about volume, volemic, hypervolemic. And what that is, when your plumbing system is missing a bunch of blood, okay, it's like a whole bunch of pipes that are half full. It needs to be full. It's not supposed to be half full. If it's only half full, well, there's no pressure anymore. You lose your blood pressure. And then you start getting into some serious life-threatening conditions when your blood pressure drops like that and you don't have enough blood in your system. That's hypovolemic shock. That's the main one we're going to be concerned about here in just a second. Septic shock, septic. Think of a septic system. It's kind of a nasty environment. Okay, that's infection or other contaminations in your blood. Okay, that's septic shock. The last one is anaphylactic shock. A lot of people are familiar with that. That is just an allergic reaction to something. If you're allergic to bees, you might carry an EpiPen for anaphylactic shock, and that's what that is. But I'll jump back to the next one, hypovolemic shock, low volume. If somebody goes into shock and they're losing blood volume, you have a lot of blood in your legs. So you want to lay that person on the ground and elevate their feet. Get the blood that they do have, most of it concentrated in the bigger, larger parts of their body. But some of the symptoms are cold, pale, clammy skin, excessive sweating, fast heart rate, shallow and rapid breathing, drowsiness, fainting, blue or gray lips or fingernails, no blood flow there. Irritability, they don't want to be bothered, leave me alone, and they're angry, and they're injured or something. Okay?
Now I got an excuse.
Or, Bill, I know that's good. Okay, dizziness, enlarged pupils, nausea or vomiting. Those are all signs of shock. When you start to see those, you need to treat people and watch carefully, because even people that aren't injured, they can be going into shock when they see serious traumatic things that you don't ever, some things you just can't see, and it's pretty hard on people from an emotional standpoint. So that's some of the things you need to consider. The way you're going to treat that, you need to get that person to lie down and have somebody help. And you need to call 911, even if it's minor symptoms of shock. Call and get some help coming, because it can advance very rapidly. Have the person lie down again and elevate their feet. Get that blood flow moving to a larger part of their body. Avoid moving them around. They may have head or neck injuries. Leave them where they are if they've been in some kind of accident. Perform any first aid like we talked about, stopping the bleeding and so forth. Take care of that person in that way. Keep them warm. Your blood keeps your skin warm. It's close to your skin. That's what warms you up. You start losing blood volume, you start getting cold. Keep that person warm. Reassure them that things are going to be okay. There's some mental stuff associated with that. People that are very concerned and fear death, it just elevates the level of shock. They're more and more concerned and more worried, and their heart rate is trying to beat faster and faster and faster, but their blood volume is not there, and it causes even more problems. So reassure those people. Refrain from giving them things to eat or drink. You know, every time you have an accident or something serious, you go into the hospital, they ask you, when's the last time you had something to eat or drink, okay? If you have to go into surgery quick or something like that, they got to knock you out. They don't want you to have stuff in your system, so don't give them things to eat or drink. Check them pretty frequent. If you have to leave to go take care of somebody else, keep checking on that person. Don't just leave them for 30 minutes and go tend to something else. Go back and check that person. So that's the main things you can do to help people with shock. If they're vomiting or something, turn them sideways, let that stuff clear out. They might not be able to clear it out themselves. Anybody that has any issues, never put anything in their mouth. Okay. If you think, well, they need to put something in their mouth, they're going to swallow their tongue. Anybody heard that? They're going to swallow their tongue. You can't swallow your tongue. It doesn't work, okay? Don't put anything in their mouth. They're going to swallow what you put in their mouth, maybe, or they're going to bite your fingers off. Don't put anything in somebody's mouth. That's really important. Okay, so that's the primary things for Stop the Bleed that I put together here. Again, it kind of sounds harsh, but if we're in a situation where we can't get to a hospital, can't get to a clinic, there's nobody out there to help ourselves or help somebody next to us. Do what it takes to resolve these problems. If you kind of look at the human body as your heart is a pump, and your blood vessels and veins, that's plumbing. And your lungs is where the oxygen gets there. Keep those things going. Do everything you can to keep the person breathing, stop that bleeding, reassure that person, and look at it like it's like they're a simple thing. The pump and plumbing and air. Keep it going, keep it going. Some people have had some horrific injuries that I've seen, and they have survived. They have survived those because somebody knew what to do, stop the bleeding and so forth. So don't give up. Don't give up on somebody. Yes, sir.
Hey, Bill, I was a state trooper for 20 years and had the EMR and was at the bad accidents, the really bad ones pretty regular, but they were really pushing this bandage too that wasn't in with what you had.
Okay.
And it's 4-inch wide, it's called a hemorrhage control bandage.
Okay.
So before you would actually go to, your tourniquet,
Yes.
if you didn't have like a massive arterial bleed or something like that, this is 4 inches wide. And you wrap it around and you reverse the wrap, and it just puts a super hard tension on the wound.
Okay.
And so you might want to set that up there too, and people can write down the information if they
Oh,
want
good.
to think about getting
Would you
that.
grab that? John?
Okay.
Yeah,
so
good. If
that's
anybody
without-
knows,
That's before you would, first you'd try with your gauze and things, and then you would
okay.
maybe try something like that before you do the tourniquet.
Okay, yeah, if anybody knows of anything like this, share it with everybody else, okay? The stuff I have is not exclusive, okay? Stuff I have, there's many different types of bandages out there. These Israeli bandages are very common. Most military surplus items are very good because they're super compressed because you're already carrying a bunch of junk anyway in combat. You want your dressings and stuff to be small and not a lot of excessive stuff, but there's a lot in that little packet once you open it up. There's a lot of stuff in there. So that's a good idea to keep this stuff on you. There's nothing worse, Scott?
I just was going to say something. I just took the Stop the Bleed course here in Rapid City not too long ago. And a couple of things about tourniquets that I found real interesting. Growing up, I thought common knowledge, tourniquets, you put them on and release them a little bit, keep doing that so that you're saving that limb. That is not how they practice it. That is not what they teach you.
No.
If you put a tourniquet on somebody, it's because they're going to die in the next 4 or 5 minutes. You're going to save them by putting the tourniquet on, and you don't take the tourniquet off. That's medical professionals that will take that off. You just put it on tight and you leave it.
Yeah.
The other thing about that is you go, well, they're going to lose their limb. But you're not worried about their limb, you're worried about their life.
Yeah.
And the information that they gave us at that course was that based on some of the best information they collected from our soldiers abroad, is that if you put a tourniquet on a limb, they can save that limb up to about 72 to 74 hours.
Okay.
So if you put a tourniquet on somebody, there's a very good chance you might be able to get them to some sort of medical help, and their limb will be okay, they'll get them to surgery, whatever.
Yeah.
And if you can't get them there in 72 hours, and you can keep them alive with a tourniquet on their arm or their leg, wherever they're bleeding out,
Yeah.
you just saved their life, because you'll never get them to a doctor in time anyway if you didn't put the tourniquet on.
Yeah.
So just a couple of facts and things to think about with those tourniquets.
Okay, I'm glad you brought that up because if you put a tourniquet on, don't ever take it off. Don't ever loosen it. It's gonna hurt, and if it hurts, and somebody says it hurts, can you loosen it? No, I can't loosen it. Trying to save your life. You're gonna bleed here. Leave it on. Yes, sir.
One never knows how they're going to react in a situation until they find themselves in that situation. So either for you, since you're EMT, or Brett, because he was a state trooper. So if you find yourself in that kind of situation, you're somebody who's freaks out at the sight of blood or doesn't know until you're in that situation.
Yeah.
What are some techniques that you guys were taught to help keep calm and be in focus in that situation? If somebody finds himself, they're like, oh my God, what are some things you would tell them to say, hey, keep calm and try to take care of this person who's in need?
Yeah, now you're talking about somebody that's trying to help or the person that needs
Yeah,
help?
somebody who's trying to help, but they're like, oh my God, this person's bleeding, they're freaking out, but they want to help out. But yeah, full of
Okay.
anxiety or so. But
Okay.
are there any techniques that you can think of for that person to, like take a couple breaths,
Yeah.
try to calm themselves down, obviously to help out? Is there anything that you know of?
First responders that went into shock and died. The first responders have. They weren't like, okay, that happens. So that's a good question. You don't use repetition, okay? Don't say, it's going to be okay. It's going to be okay. It's just going to be okay. Okay, talk to the person. It's just say, hey, look, we can handle this. We can do this. Just sit down, take a few breaths, just talk to them or calm them down in that manner. But don't use repetition. I mean, you're a police officer, and it just drives me nuts when a police officer responds to something and somebody has a knife. And all they can say is, drop the knife, drop the knife, drop the knife. You hear that like 500 times, drop the knife. The guy doesn't say, hey, what's going on? How can I help you today? What's got you agitated? There's none of that dialogue. So you gotta talk to people. You really gotta do what you can. Be a good communicator with that person to get them calmed down. So, and then same thing with victims when they're injured. You calm those people down. When you come upon traffic accidents and a family's involved and somebody's kid is seriously hurt and there's parents involved and there's other kids, there's a lot of emotional stuff going on there. There's a lot. You got to kind of have enough people try to help separate that. If a family member or somebody is horrifically injured or something like that, you don't want to have the rest of the family hovering around. Sorry. I don't like being that was the hardest thing when I was an EMT, dealing with kids. But the thing is, you don't want the family gathered around there while you're trying to take care of this person. Say, look, I need some space, and get some people to help spread them out and get them away from there so you can take care of people. But it's a big emotional thing.
What you said
you
at
gotta
the very
control.
beginning, because, he just told you, first air,
Yeah.
second
Blood.
breathing, circulation, he said blood,
Yeah,
circulation, just triage to yourself, okay?
yeah.
Take all the emotion out of it and do what you can do.
Yep. Stick with the basics,
Going to
It's
mode.
very hard to take the emotion out as a bystander. I did a lot of simulations, acting people hurt that are not really hurt, and just walking it through that way, and having, for me it was instructors critique the situation. I've done classes where you pretend like you're coming up on an accident and you walk through it in that situation. I've put on classes that they've had where I put makeup on so we can make it very realistic, and just playing that in your mind, all the different scenarios that can happen, what is, and walking it through as a bystander or as a EMT nurse.
Yeah. So, yeah,
But
there's things you can do to
when
train
you're in
with
the
them.
hospital, you do okay, right? If there's an emergency, you just,
I've done simulations in training for nursing and ambulance. And I know that I've even put on classes for people that that say you come up on a wreck and you have a person bleeding and doing the makeup and stuff like that. So it's as realistic as it can be. And the people your actors act like they're in pain, and you walk through that situation as a person helping.
so what would you tell him to do then? When you come up on that then?
Well, there's certain classes that are put on. I know a lot of the volunteer ambulances put on classes and simulations like that. See if you can. It's good practice.
Yeah.
I would,
Yeah.
Every circumstance you come on is going to be really different. Nathan, real quick, I think Nathan has a, or
I think there are a number of reasons why people may not want to do something. I mean, they may not want to hurt the person. They might be freaked out by it. One of the, I was stationed in the Seattle area years ago, and we had a Red Cross first aid training from a flight surgeon. This guy was top notch. And he said something during the training that's always stuck with me. And that was, don't be afraid if you don't know what you're doing. If you don't know how to do whatever or do it right, do something. Doing
Yeah.
something is better than doing nothing.
that's true. Thank you. Something's better than doing nothing. Yes, sir.
If you have all these tools available to try and stop bleeding, in what order would you attempt to use?
Bandage and direct pressure is just the primary thing you want to use. Because your body tries to preserve itself. It's self-preservation. There's some things it does that you have no control over with endorphins and adrenaline and different things like that. Vasoconstriction that your body's going to try to do to shut off its own blood supply. It's going to try that. Natural clotting is platelets that kind of form together and group together and thicken the blood. So direct pressure and bandages, that's a big thing. You can stop a lot of bleeding, some pretty rugged injuries with just that alone. So that's what I would say, but don't ever remove a bandage. Keep adding if it is bleeding. Brent?
that bandage I put up there, if you want to find it on Google, just search Israeli compression bandage.
Compression
Different than the Israeli bandage that you've got there.
The
It's
one
called
he's got in the
compression.
package.
Yep.
Yeah, the one I've got in the package is called the
This one.
Israeli compression bandage.
Compression bandage.
They're about 2 for $16 or something like that. And just on the other, answering Philip, what would you do if someone was there wanting to help? Basically, you know, when you go to emergency scene as a professional, you already have things you're gonna do set up in your mind. I'm working on this, working on this, working on this, working on this, calling these people in, you know, but I would just ask them to go do something. Could you go get that bag over there out of, you know, if you actually needed their help. If there are already enough people there, I'd ask some of the people, hey, could you keep those other people back? That gives them something to do, less thinking about maybe what they're seeing, the gory scene right there. But they're standing out there saying, hey, we got enough people up here helping, we don't need any more help right now. You know what I mean? Things like that. Just give them something to do so their mind is focused on something else as opposed to, you know, what they're seeing or what they did see. But that's kind of what
I
I'm.
got
That's a
another
good deal.
tiny thought, is that head wounds bleed a lot, and it's really not
Yeah.
very important. You know, if we can know that,
Yeah,
you know, it looks like horrible, but
Yeah.
it's probably a very tiny little thing underneath there. So.
yeah, head wounds look horrific. They
Yeah.
really bleed a lot, and they're usually not that bad. Intestinal wounds, you don't ever put intestinal parts back in the body. Don't do that. Protect them in place where they are. Doctors can do that. You try to put something back in, you can put debris in there, and bacteria, you're causing problems.
Also, if you have something that is pierced a body part, leave it.
Yep, leave it alone. Don't remove objects that are impaled, just don't do it. So that's a good thing you brought that up. A guy we know, when we receive bees, honeybees every year, they bring truckloads of bees. So this guy comes up and he said, did you hear what happened to me last month? Like, no, I didn't hear what happened. So picture this, it sounds pretty horrific, but let me get to the end of the story. Anybody seen a bell spike? It's these big steel spikes that you see the round bells out in farm fields? It's a big spike and it's attached to the tractor and it's about 4 feet long. And they just drive it into the bell and pick it up and they go stack these spikes. So I don't know why, but this kid had this bell spike connected to the tractor, but it's pointing up. So he's climbing on this water system, one of the big wheeled water systems that go in water fields. He's climbing up doing something on top of this system, okay? Falls backwards onto this bell spike. 4 feet long, it's about that big around at the base, okay? It goes all the way through this guy. Now, remember, this guy just asked me, did you hear what happened to me a month ago? So the story ends well. So he falls on his bell spike. There's about, I don't know, 2 or 3 inches from his back to where it's welded onto this big thing on the tractor. So if you're showing up as an EMT or a fire department, what are you going to do? This thing's attached to a tractor. You got to cut that off or something. You can't just pull the guy off of it. So they're trying and they break the jaws of life, and they try grinding and they can't grind the thing off, and they're trying to cut it off with a torch, and the fire department is trying to keep spraying water and keeping the guy wet while they're trying to torch it, and the water's keeping the metal cool. And it took almost 3 hours to get this spike separated, to put him on a helicopter, to fly him to Iowa, down by Sioux Falls, that big city down there, Sioux City, Iowa. So they fly him down there, and they remove this bell spike, and a month later he's walking around, no problems. Okay? Those things don't have a really sharp point, they kind of have a round point. So what happened when this bell spike impaled the guy is just going through, every vital organ was just pushed out of the way. And it just went through it. That's all it did. So he's lucky it wasn't very, very sharp, but it looked horrible, looked horrendous. But you see something like that, don't give up. Take care of the person. You know, no matter what it is. Being a combat veteran, I've seen some horrific things, and I've always been amazed at what people can survive through if other people will just do what they have to do right now, stop the bleeding, keep the air going and the blood flowing, and get them off the hospital. You can really save some lives. Don't be intimidated by it, just do it. Yes, sir.
So in that situation, they've been trying to manage his pain during that period?
I wasn't there, so I don't know what they did. And I'm not sure what his level of pain was. I saw the pictures. It's pretty hard to look at. I'm like, I don't want to look at that. You can't unsee some things. But
He'd be in shock.
it's pretty bad. What's that?
You think he'd be in shock?
Yes.
I think he'd be in shock. Now the thing was, his what was it, his brother or his uncle?
Someone.
He served multiple tours in Iraq and Afghanistan. He was in the National Guard. and he was out and he was working close by, and another friend who was with him doing this called him and said, hey, guess what happened to whatever? He's stuck here. And he was in shock. He didn't know what to do. He didn't even call 911. He called his uncle or whatever. His uncle like, what? What's going on? Call 911. So that's kind of how that all unfolded. But horrific stuff. You can save somebody's life. Just do it. Don't be intimidated. Don't be afraid to do it. Here in the church, we do have an AED back here on the wall. That's an artificial fibrillation device, or I don't know what the AED stands for, but that's what it does. It starts your heart. Those things are amazing tools because you don't have to know anything to use that. You open it up and you turn it on, and it's going to tell you what to do. It talks to you. It'll say, remove this pad, and you do that. And then you hit next, and it's going to say, do this. It's going to completely walk you through it. It's even going to tell you, stand back for testing, and you stand back. You don't touch anything, and then it's going to tell you to push this button, and it's going to say, wait to deliver shock. And it's going to tell you whether you should shock this person or whether you shouldn't. The machine does it all for you. So don't be intimidated by using those. We got one back here, and we got one over in the mansion too. So we have that kind of stuff here. You know, we have some first aid stuff here, and a kit back there. A lot of us carry trauma stuff in our cars. Yes, sir.
I just want to really reiterate the point that when Lydia and I came across an accident on the interstate in the middle of the night.
Okay.
It was a rollover, and it happened practically in front of us.
Wow.
And you just kind of, we pulled over, we had the kids in the car, they stayed in the car, we went out and tried. And the one lady had a child in her arms. And I could tell right away the child was having a difficult time breathing. I thought, man, you know, and I was trying to talk to her. There was alcohol involved.
Yeah.
So I was talking to this woman. I said, please, you just put the baby down on the highway here. Put the baby down. Not touching her or nothing, but I just kept telling her, talking to her about that.
Yeah.
Because this baby just kept struggling, you know. And I got to be honest, it was the first time I almost hit a woman.
Yeah.
Seriously, I was concerned about that baby.
Yeah.
The minute she put the baby down, the baby started to breathe.
Oh, nice.
So she was obstructing the breathing on that baby.
Yeah.
So you just never know what's going to happen.
Yeah.
You just got to stay calm and do your best. You know, I have a belt, that's a tourniquet.
Yeah.
You know, there's a lot of things you can do. But that was the most interesting time we had there because it was just, what do you do? You got it. She would not let me take the child, you know, and it probably was what? Seemed like forever, but it was probably a couple of minutes she finally put the baby down. And thankfully, somebody already called the ambulance, and they give the EMTs a hard time. One gal had a big, gash in her knee or something. Didn't want no help? Fine, we're not going to help, you know. It was an alcohol thing. But that was interesting. You just got to talk them through it. You just can't stop.
Yeah, that's a good thing. Thank you. Thank you for sharing that. That's really good. Yeah, there's some things, like a tracheotomy. Who knows what a tracheotomy is, right? Okay, if you're choking and you can't get something out of there and it's done, there's nothing else you can do. And the last resort is tracheotomy. Okay, I know how to do a tracheotomy, but I'm not going to do a tracheotomy on somebody because that's a bad thing. That's dangerous. People can die from a tracheotomy. Now, if you can't breathe and we've done everything we do and you're not breathing and your heart is stopped and you're clinically dead, I'm going to get you breathing. I'm going to open you up and I'm going to give you a tracheotomy, right? But that's an emergency only situation. I know nobody's coming. Help is days away or not coming at all. That's an end of the world situation. Like we're talking about society collapses and we don't have doctors. We can't do something and somebody's choking. You can do that. But there's a lot, when somebody's choking, you can really push on their diaphragm, the Heimlich maneuver. I've had multiple kids that I've put on my hand, chest, and I've hit their back pretty darn hard, and then pennies and coins will come shooting out of there. And they'll breathe again. So don't be afraid to do it. If you have to hold them by the ankles and shake them out, it doesn't matter. Do what you got to do to get people breathing again. And if you just can't get it out, you may have to do something like that.
Suzette and I took a class, an EMT class, in the Seattle area years ago. There were two paramedics that were teaching one weekend, and they shared a story about a kid that they had worked on the previous weekend. They worked that kid. The kid stopped breathing, went into cardiac arrest. When by the time they got there. They worked that kid for 2 hours. They were both just puddles of sweat by the time it was done, but they saved the kid. So 2 hours.
Yeah.
So a lot of times people don't come back from that, but kids especially seem to be kind of resilient. So, and because it was a kid, they kept going.
Yeah.
Normally they wouldn't, but 2 hours, so.
It's a long time.
Yeah, it is. It's a very long time, and it's hard to do. But I just mentioned that because sometimes you just can't give up.
Yeah, it's like CPR. You don't stop CPR until you can no longer do it yourself or somebody else can take over. That's just what you do. I mean, the heart's a pump. I mean, it's an amazing tool, but how it works, the muscles constrict and squeeze it. And when it squeezes, it pumps, and when you let it go, it refills itself. That's all it does. It's muscles that do it. If the muscles can't do it and you're pushing on it, the heart is pumping. You're not doing anything magic, you're just making the heart pump. So people are kind of intimidated by CPR and stuff like that. I may not do it right, or is this working and I don't know enough about the heart, or I don't know enough about this stuff to make it work. It's not that complicated. Push the heart, make it pump. That's all it is, you know. If the person had a horrific wound and I could see their heart, you know, I could take a rubber glove and I could probably squeeze their heart and make it work. I mean, that's a drastic situation, but that's how the heart works. Just make the heart pump. It's pretty simple. That when you simplify things and think about it simple and don't give up and think about little ways you can do to stop bleeding, it's not that bad. When you buy stuff like this, we already mentioned getting in bulk, getting on Amazon, stuff like that. You can maybe get some stuff wholesale. I got these rolled gauze. Rolled gauze is really nice because I hate trying to fix some kind of wound, like when I get tangled up in the table saw or some of the various other things that happen on a regular basis. I like big bandages. I like to stick it on there and wrap it up and stop that bleeding, you know. Like little tiny bandages, that's kind of silly. That doesn't work for me. So when you get these, this is like 24 rolls. There's a lot of bandages here. These work really good. So yeah.
One day I came home, it was after work, and he's in the garage, and he's working on his table saw, and I drive in up in the driveway, and I turn off the car, and I see him go, ow, and he's in front of the table saw. I'm like, great, we're going to the ER. So off we went, and so yeah, we kind of keep that stuff on hand.
Yeah. And I've got a lot of stitches, I got to tell you. And, you know, it works. You can stop the bleeding and you can save yourself, or somebody else can save you, or whatever. You can do it. So all this stuff right here, I see the tourniquet passing around. Some people tried this. Tourniquets can be strings, belts, ropes, anything to stop that bleeding, but you want to make sure you stop it. In a broken bone situation, I'm going a little bit more to stopping the bleeding, but if you're in a broken bone situation and you are really remote, and no help is coming, you can't get help. People in a lot of pain with broken bones, you really got to be careful, because a broken bone can be very sharp. When you're moving it around, you may not be internal bleeding or anything, but you can cause internal bleeding because that bone is going to cut something. But if you have to, you can put a bone in traction, and what that means is if you have a break on your arm, and you pull that and you separate that bone, that person that's in a lot of pain, it's going to be like, oh, thank you, that's really nice. But guess what? You put something in traction, you cannot release it at all. The doctor can release it, they can x-ray it, see what's going on, and then they can release it. But if you ever decide that it's necessary to use traction on a leg or some kind of bone where, you know, your arm's bent and there's a severe pain and stuff, and you need to pull that apart, you can't release it, because when you release it, those bones are coming together very sharp. They can be cutting tissue and veins and vessels, and you can cause internal bleeding, and it's bad. But when you put something in traction, it takes that pain away tremendously. But don't do it just to take somebody's pain away. It's only if you have to do it. But if you put it in traction, you got to hold it in traction until the doctor takes care of that. So if you got somebody in traction and you're doing it manually, not taped on a board or something like that, well, whatever strength you have that caused that traction, you better be strong enough to hold that for a couple hours or whatever till you can get this person to a doctor. So, okay, so that's some things you can do.
I don't see how that would work for a compound fracture.
Well, if you have multiple breaks in the same bone, it doesn't really work so much. If it's just a, it could be not a straight break, it could be an angle break, but both bones are really sharp. You can still put that in traction and get rid of some of that tension and stuff where the bones are rubbing on each other trying to move somebody. But traction is really something you shouldn't do unless you have to.
I fell and broke my ankle in 4 different places. And none of the bones came out. But when the ambulance people got there, they wouldn't even try to put me in traction. They wrapped my foot in a pillow and then put me on the thing because they didn't know. So if it were me, I would never try to put somebody in traction.
Yep. Never do it unless you have to. Splint it in place right where it is. Don't move it. Keep it from moving around. Movement is what causes the pain most of the time on a compound fracture or break. Just keep it right where it is. That's important. Okay? Another tip for guys, if your wife ever has an injury, and if it's a small one, but it's big to her, if you use the phrase, do you want me to call a ambulance? Okay? You're going to have a lot of trauma yourself, right, ladies? Don't use that phrase. I didn't use that phrase. But I'm just saying, don't use that phrase. I've heard it used, and that's not a nice thing, and your wife is going to give you a lot of injuries if you do that. Okay? So, anyway, any other questions or anything right now? Yes, sir.
There's a great class on YouTube by their channel's called Carry Trainer. They have a 3-hour course on basically going over all how to apply all this stuff like in the Combat Lifesaver course. It's
Oh, good.
An awesome class.
And what's it called?
The channel's called Carry Trainer.
Carry?
C-A-R-R-Y.
Carry Trainer.
Oh, okay.
Okay.
They're all Special Forces combat veterans.
Okay. Good to know. CarryTrainer.com.
You can also look up Refuge Medical on YouTube or online. They have a lot of the products that you're talking about for tonight, and they have actually videos and stuff on, some videos on how to use it and what you can put together for a kit, that kind of stuff. But that's a good resource too for you.
And it's Refuge Medical?
Refuge Medical is what it's called.
Refuge Medical. Yeah, YouTube is a great thing. You can find a lot of stuff out there.
Helpful stuff.
Yeah,
Because some stuff you see on YouTube, you might not ought to do. There's some stuff on there that's, I don't know why people do that, but they put stuff on there that's fake.
Bill, do you have any comments on protecting yourself from bloodborne pathogens? Since a lot of this talked about blood injuries and you don't know what other people's blood might have.
Yes, thank you for bringing that up. I totally forgot about that. If you have gloves, use gloves for yourself so you don't get bloodborne pathogens from somebody else. Because the blood, they can be carrying different things, hepatitis, stuff like that. And you can get involved in that and they can contaminate you. You can get it in your eyes. You can accidentally have blood on your hands and wipe your eye or something like that. Or wipe the sweat off your forehead and you get somebody else's blood in your eyes or something like that. And it's a dangerous thing. So make sure you wear gloves and protect yourself from bloodborne pathogens. You have to remember the heart is a pump and there's some good pressure there sometimes. So when arteries and stuff are involved, blood can shoot tremendous distances. When we did our Combat Lifesaver course, they would tell you how to insert the needle and set up the IVs, and we did it. We practiced on each other, and we were so sore, our arms were hurting, we gave each other the IV. But once in a while, somebody would insert a needle, and then they would just let go. And so now the end of that needle's like, I mean, that blood's coming out. You know how much pressure your body has blood-wise when that happens. You can really breathe out. So same things with accidents. You can have a lot of blood there, and you don't want to get it in your eyes or on yourself. So that's what you're talking about, right? Okay, so yeah, protect yourself. Wear gloves if you can. And don't, even EMTs are told, don't rush into a scene until you see what's going on and make sure it's safe for you. People want to rush up and help somebody and not take the time to put on the gloves. Put on the gloves. Make sure you're safe yourself. And then again, make sure the scene is safe. If there's a car accident and the car is laying on its side, don't jump up on that car and try to climb in there to help somebody. That car may be ready to tip over. Now it's going to fall on top of somebody else that's standing over here trying to help. Make sure the situation is stable before you interact with that. If a house is on fire, who's going to run into a burning house? You have to remember, a house fire is not a campfire that you smell and smoke is irritating. It's all toxic because a house fire is carpet fibers and glues and epoxies and everything else. You can take one breath of a house fire and you can die. So it's different than breathing campfire smoke. Think about that. So if you run into a house to save somebody, you have a whole different kind of smoke than you've probably ever experienced in your life. Okay? Somebody had a question?
I put my hand up. I was just going to say, just because you were talking about accidents, because on the highway or something like that, secondary accidents are a big thing. So if you jump out of your car to go help somebody, people behind you that are coming up at 70 miles an hour, They don't know that there's a car there, and boom, a lot of people have died trying to help other people in accidents.
Yeah, that's a good
So,
point. Very
so
good
you
point.
gotta control the people that are coming up somehow before you can even help some of the people that are in the car, or you can get yourself killed, and it's happened a lot.
I was driving to Spearfish. This is crazy. Years ago, I'm driving to Spearfish, and it's just starting to get dark. It's not dark, but it's getting there. And I seen a whole herd of deer. I have no idea how many. They're running towards the interstate. And they're going to jump the fence. And I seen cars behind me, and I seen it happen. So I was flashing my lights, tapping my brakes. I was actually swerving back and forth, back and forth. So hopefully the people behind me would say, hey, that guy's there's something wrong. I better stop. Did they stop? No. They blasted by me full speed. They went right into that herd of deer. And they hit multiple deer. It was a pretty bad situation. Nobody in the vehicle was harmed, but they took out multiple deer and just trashed their vehicle. And they just didn't even pay attention. So you're trying to get other people's attention to say, hey, there's an accident here. You know, if you see flashers, you better slow down and stop. A motorcycle could crash at nighttime and their motorcycle rider laying on the ground, and somebody's trying to warn you, and you just blast around their warning and run right over that guy laying on the ground on a motorcycle or something. So it can happen. You've seen it.
I have just kind of a practical question about, I mean, I'm in no way able to teach this sort of thing, but there's a lot of really sophisticated people in this church that could, I mean, if you have a bladder infection, you can die.
Oh, yeah.
Or get a car wreck. So I was wondering if we shouldn't have a course on that sort of thing. How do we treat minor acute illnesses at home?
That would be a good idea.
And how do we get people off prescription drugs onto something else if there's alternatives?
Yeah.
You know, these really practical things.
That's a good thing, because how many people don't treat themselves or go to a doctor, and how many people ignore something until it's too late, or ignore it until it gets really bad? You know, you got to address things. If you're not feeling well, something's just not right. Figure out what that is. Don't ignore it. So that's a good thing. That'd be a good class, I think. Okay.
Are you gonna go over anything about packing wounds, like in an abdomen or anything?
About packing wounds?
Yeah. Are you gonna do anything with that?
I didn't plan on talking about packing wounds, but I can.
I can, that Stop the Bleed course gave us a little bit that was really pretty interesting. And essentially, all the bandages and stuff that they've been talking about us using in that to stop your bleeding, excellent stuff, use it if you've got it. But anything you have, your t-shirt, anything you've got that you can pack a wound with, an abdomen wound or something, you can stop the bleeding with that and keep packing it. And don't ever take it out. Once it starts clotting in there, you leave it, because that's the job that it's supposed to do. And if it's not a clean shirt or not a clean towel or a drape off the side of the window, whatever, if you can pack that wound and get that to stop with some pressure, you're saving a life again. Again, you're saving a life. So that's the whole goal of that.
Yeah.
Just throw that out there as more stuff you can use.
Yeah, wound packing is something you do. The primary goal is keep the blood in the body. The heart is a pump, so it takes the blood from somewhere else too. So if you have it in the body, it's not necessarily sucking it back into the system, but at least it's there, it's in there, it's not out, and you're not losing volume. So keep the blood in the body no matter what you do. That's really, really important. So, any other questions? Because that's kind of all I have. These, Wes, where's Wes go? Now, Wes gave us all of these things. This is really awesome. Wes gets these things and you don't use them. There's a ton of them. And you're welcome to take these. I'm sure there's at least one for everybody in here or more. What is in this? This is a dressing change tray. But it's good for a lot of injuries because it has a mask, CSR wrap, a pair of gloves, alcohol swabs, swab sticks, sponges, 4x4 gauze, several of those, adhesive tape, different other types of tape, a tray to put alcohol in. This is just a pretty good little, it's not a first aid kit by any means, but it's a good little trauma kit for injuries. Keep these in your car, put 2 or 3 of them in your car. Car accidents, this stuff may come in handy.
Next to the table saw.
Yeah. So there's several of these in here. This thing is full. But if I don't get injured, I don't keep my tool supply built up. So if you're free to take some of those if you want, get however many, and take one. And if there's enough for more, take 2 or 3. We can divide them up. Whoever wants those things. So it's good stuff to have. These tourniquets, if you want to try one of these and just test it out, just open it up and use it. The tourniquet doesn't have to be sterile. It's not going on a wound for sterility. It's stopping the bleeding. So there's some circulating around here that's open. It's just a little zipper, or what do you call it, closure, like a Ziploc closure. Take them out, and it comes with instructions, it tells you exactly how to do it, and it's just so easy, you can just put it on there yourself. They actually make some clothing that have tourniquets built in, like at the hips and different places and on your wrist, and so if you're ever in a I guess a combat situation, you get shot in the arm, you can twist it up and tie it off and keep fighting, I guess, and you get shot in the leg, you do that one.
Rambo.
It's like, yeah, Rambo, pretty soon you have all kinds of bullet wounds, but you're okay, because the blood's inside, you keep fighting. But yeah, there's clothing with tourniquets built in, and it's kind of strange, but kind of a good idea at the same time. So that's all I have. If anybody has any questions, I'll try to answer them or find out.
Bill, here you go.
Bill, would you like to pray us out?
Sure.
You want me to put?
Okay, let's pray this out. Lord, thank you for everything you give us, provide for us. Thank you for all your knowledge and wisdom, the things we talk about, and the things we do in these classes to share with people. Wisdom comes from you, and we thank you for our safety and our health and all the things that you truly do to look out for our church family, our families. And without your grace and mercy, we would truly be lost. We thank you for that. Amen.
Amen.
Thank you so much.
Do you ever use Microsoft Excel?